Hello, everyone. Welcome to our second episode of Behind the Graph. Today, we are talking about community spread with our epidemiologist, Shane. And once again, I'm McKinley from the Teton County Health Department. We'll just jump right into it and talk about community spread. So, Shane, our first question, what is community spread? Do you mind explaining it?
Yeah, absolutely. Hi, everyone. So essentially, community spread just means that a disease is spreading within the community in a way that we can't track it. When a case is said to be attributed to community spread, it really means that that person didn't have any knowledge or didn't report having been exposed prior to getting sick. Essentially, the case has no idea where they got COVID from.
Right, so it can't be technically, it can't be traced back to a specific event or a specific person.
Exactly. It's kind of in contrast with someone who's had a known close contact event. If they haven't reported anything like that, we call it community spread.
Interesting. Okay. And what kind of personal behaviors contribute to community spread? Like, are there any specific kind of high-risk activities or any actions?
Yeah, so, community spread, it can happen under a variety of different circumstances or events. If you don't know that your employee or your coworker was sick or they didn't have any symptoms and you get it from them, but you don't know it, that would be considered community spread. That being said, you're going to see a lot more of community spread if you have things like large gatherings, large groups of people, especially in indoor places, and particularly in circumstances or places where mask usage isn't possible or widely followed.
Right. Okay, interesting. All right. And what does a high level of community spread mean?
Yeah, so essentially what that means and why it's a problem is that there are gaps in our knowledge. If the percentage of cases due to community spread is high, it really means that we're not able to connect cases together, which could indicate that we're missing cases, and it could also indicate that there's still a lot of virus out in the community that we don't know about.
Yeah, it must make contact tracing even more difficult. There's missing links of the puzzle almost.
Exactly, and it increases the chances that someone could be out in the community while infectious, even if they don't know it. So
Right.
A high level community spread is definitely a significant issue.
Totally. And that just emphasizes even more why people need to keep practicing these personal protective behaviors, because you never really know.
Absolutely.
All right. And how does community spread affect the risk level in Teton County?
So community spread is more of a secondary metric. It gives us more information about the situation, but it's not weighted as heavily as kind of those primary metrics, things that really indicate how we're doing, such as the number of new cases, how high hospitalizations have been, and things like the contact tracing capacity. So important, but on that kind of second tier down from those primary concerns.
Right. And Shane, do you have any specific recommendations on how people can really protect themselves from possible community spread?
Yeah, so it's going to be a matter of really, again, like I said, it can happen under any circumstance, but those crowded indoor places especially are going to be the things that you're concerned about. If you're around a lot of other people and one of them happens to be sick in the crowd somewhere, you're almost guaranteed to not know that you got it from that person.
Yeah. Awesome. All right. Well, Shane, do you have anything else that you want to mention about community spread?
No, I think, as always, just asking everyone to continue to do everything that they need to protect themselves and the community. Like we were talking about last time, I know that this has been going on for a long time and everyone's really sick of the pandemic, and things are looking better now, but we're definitely not all the way through this yet. So as tough as it is, everyone keep up the good work.
Absolutely. Yeah. Thank you for mentioning that. Well, that will close us for today's episode, and we'll see everyone next Friday. And just a friendly reminder, you can submit any questions or topics that you want to be covered to our Facebook and Instagram accounts. You can just send us a message. But we look forward to seeing everyone.